I've been interested in the intersection between good food and wellness and poor food and illness for the last 31 years while I've been practicing here in Brunswick. And it's amazing what can happen with careful diet and lifestyle and our risk of disease. So when COVID first came on our radar screen, so to speak, I was curious as to how this disease was contracted and if there was anything that we could do to lower our risk of severe disease. As you know, it is a coronavirus, and many viruses are coronaviruses. In fact, cold virus, that's a coronavirus. And if this was a simple cold, no one would be wearing a mask, or few of us would be, and we wouldn't be worried about dying. But this is a particular kind, and as you know, many people have died from this. It's a disease that we need to take seriously. We have over 200,000 deaths in this country alone as of now, and worldwide, of course, it's much higher than that. So it is an illness that we need to take seriously. It's an illness, unfortunately, that is often most infective or most infectious before you even know that you have the disease. And that's why it's so hard to control in our communities, because you can be feeling absolutely fine and think, well, I can go visit, I can do whatever, I don't have to wear a mask, I can't be sick because I don't feel sick, and at the same time you can be spreading the illness. So it's a particularly hard illness to deal with, and because of that, we need to, even when we're feeling well, do whatever we can to strengthen our immune systems so that if we get the infection, we don't have a severe case. As you know, about 80% of people that get this infection have a mild case and are over it within a week and feeling fine. But 20% of people don't, and of those, some end up in intensive care unit and some have a prolonged illness. I have one patient that's been suffering from this now for about 6 months and still is not back to her baseline health, and she was relatively healthy at the start of the infection that she got. So it can have serious problems. So the first thing, of course, is to wear a mask. You'll notice that I have one on tonight, and no, you won't catch COVID from me over Zoom, but there are a few other people in the room tonight, and so that's why I'm wearing a mask. And the other simple thing that we can do is wash our hands so that we don't contaminate and get the infection through touch. Wearing goggles or glasses can also reduce the rate of infection, as wearing glasses, you protect your eyes to some extent. And in China, they did studies to show that people that wore glasses because they were needed for prescription reasons had a much lower risk of developing COVID. The infection can enter your body through your membranes around the eye. So that sort of goes without saying. You all know that by now, I hope. Another thing that you can do, not to avoid getting the illness, but to lower your risk of severe illness, has to do with weight loss. We know that any time that your waist is bigger than your chest or your hips, your risk for COVID goes up. People with obesity are much higher risk for serious COVID infections if the weight is carried around the middle. If you have big hips and big thighs and your waist is preserved, your risk doesn't go up as much. The reason for that is weight around the middle, central obesity, carries with it a risk for increased inflammation. And that inflammation causes high blood pressure. It causes a increased risk of diabetes, an increased risk of coronary artery disease, and all of those illnesses are associated with a much higher risk for severe COVID. So anything that you can do to move the weight off your middle, either lose it or move it up onto your chest, gentlemen, or ladies, if you're lifting weights, slim down the waist. The other thing that you can do that cuts the fat deposit around the middle is reduce your intake of refined carbohydrates, because high insulin levels are needed to put weight around the middle, and if you eat in such a way that your insulin levels are lower, and that's by cutting down on refined carbohydrates, then you tend not to put the weight around the middle. It also helps to choose your parents carefully, because genetically we either lay down our fat here or here. And if you didn't do a good job with your parents, then eat carefully. And if you did do a good job with your parents, still eat carefully. Well, what if you're at the right weight and, well, first of all, before I move on, what if you have diabetes? Interestingly, if you have type 1 diabetes, which is not related to weight and inflammation, there does not seem to be an increased risk for serious COVID. But if you have type 2 with the central obesity, your risk does go up. It is somewhat your blood sugar, but not a lot, as you can see, because type 1 doesn't convey as much of an increased risk as type 2. I would recommend you get your blood sugar down, simply because we know that high sugar in the blood reduces your body's ability to fight infection. That's why diabetics are more susceptible to infections of all kinds. So improving your glucose control, your blood sugar control, is really important to lower your risk. And also losing weight, that will help a lot in lowering your risk. So this is a good time to go on a diet and go on one in earnest because of this infection. One of the reasons why we have a high death rate and a high serious illness rate from this disease in our country is because 30% of our population are obese and 70% of the US population is overweight. And so what might be a very relatively mild disease where we all fit and at the right body weight is much more serious because of our poor baseline health. But let's say that you're at the right weight and you're wanting to do something more to lower your risk of a severe infection. The most important thing to understand with COVID is how the immune system is working. And there are two parts to the immune system. There's the innate immune system. That's the immune system that you're born with, and it fights infection right from day one. You don't have to develop that part. It's right there and active. And it is the innate immune system that is most effective in fighting COVID. Why? Well, because COVID is new. It's a new infection, and our bodies haven't been exposed to it before, and so we have to rely on the innate immune system as a first line of defense against it. The second part of the immune system is the adaptive immune system, and as the name implies, it adapts. That's the part of the immune system that works when you get an immunization. You're exposed to a foreign substance, your body recognizes it as foreign and makes antibodies to that antigen that's injected into you in the immunization, and then you're primed to fight the infection. Unfortunately, it looks like quite a few more of us are going to get this infection before immunizations are available. But we can still do things to lower our risk of getting a severe infection. And it's by strengthening the innate immune system. As you know, initially, everyone that gets this illness is we're not affected very much. The first 3-4 days of the infection, even the people that go on to get a serious infection don't feel too bad. The reason is, it isn't the innate immune system that gives us the trouble, it's the adaptive immune system that kicks in later. In COVID, if you have a mild illness, what we find is the innate immune system in mild illness is very active, and it goes in and really hits that COVID infection and knocks it out, and then things settle down. Whereas in serious illness, the innate immune system doesn't give that good punch first, it just kind of a weak response. The innate immune system is what produces a substance called interferon, and it's very well named because interferon interferes with viral replication. It notifies the cells, a virus is here, don't let it in. A virus is here, kill it. And when you get a good boost of interferon from the innate immune system, you don't get a serious COVID infection. But if you have just a little bit of response from the innate immune system and your interferon level just goes up a little bit instead of a nice big jump, that's when you get the severe infection later on. In the severe infections, you get a mild, just a little bump in interferon, and the innate immune system is a little bit weak and doesn't respond. And then in the second phase of the immune system, things go overboard, and you get the inflammation, and you get the immune system actually destroying yourself. That's why we use medications in late phase COVID to down-regulate the immune system. Steroids are the most effective medication. So far, we hope to have better ones in the future, but dexamethasone, which is a steroid, turns the immune system down, and that's because it's overreacted in the second phase and it's underreacted in the first. So what we want to do to lower our risk of severe COVID is to build up the innate immune system so that when the virus, we're exposed to it, we have a big boost of interferon and we really hit that infection hard and knock it out. And then in the second phase of the immune system, you get a mild response, as you should, and you get over it. And that's ideal. So the question is, how can we build up the innate immune system? Well, when we have a pandemic worldwide, what we're looking for to build up the innate immune system is something that's, number one, easy, number two, not expensive, number three, ideally not dependent on medication, because we have to have this ready now, something that all of us can do and learn very quickly, because this is so widespread now that if it has to come from a drug company or if it has to come from far away and you need a lot of it, it's going to be very expensive and not readily available, and because of that it won't be very effective. Now, what I'm going to cover next is not new. This has been known for a long time, but because of the way medicine works in our country, it isn't used as much as it used to be. If you go back to the late 1800s and the early 1900s until penicillin was developed, the only way we had to fight infection was through some of the methods that I'll mention. So what I'm going to cover tonight is not new, it's old, but it needs to be rediscovered. In fact, one of the gentlemen that won the Nobel Prize in medicine in 1927 won that prize because of his work with syphilis. And syphilis before antibiotics was a terrible disease. It caused major problems and death. Unfortunately, in a sense, it wasn't death right away. It was a prolonged illness. You had primary syphilis, secondary syphilis, tertiary syphilis, and it just destroyed people. And this doctor found that if he gave people a fever, he could stop the infection entirely. And in 1927, he won the Nobel Prize because of his work. And the next year, penicillin was discovered. And then we had a pill. And why go through all of the rigmarole of giving people fevers of various ways? He did it first with malaria and then found that he could do it simply with hot baths, and we'll talk about that. And his methods were very successful, but you could get the same results by taking a pill for a few days. And there's money in pills and not very much in fever treatments, and so that fell out of favor. It was used before that by a gentleman here in the Northeast named Jackson. He treated diphtheria in the late 1800s with fever treatment with great success. And during the epidemic of flu in 1918, there are reports of very successful treatments of infection with simple treatments, some of which I'll go through. So if you have your handout there online, you can look at it. The first one that I'd like to talk with you about is simple. It's rest. Now, if you look at studies from the University of Pittsburgh, they took people, they must have been medical students that needed money, or maybe college students, because they took these people and they injected a rhinovirus into their nose and gave them a cold. And they wanted to see who came down with the cold and who didn't, and test variables. They found that the most predictive thing that they could use to decide who was going to get a cold and who wasn't was how long they'd been sleeping. And if these students had slept for, on average, 8 hours a night, they were 5 times less likely to contract the cold than if they had had less than 7 hours of sleep a night. But they wanted to look at that more specifically, and they found that the most important hours of sleep were those before midnight. Because before midnight you have what's called delta sleep. That's the deep sleep. And if they had gone to bed early, by 9 o'clock or even before, and had good sleep before midnight, they were much better able to resist the infection. Why? Because their innate immune system was stronger and they could get a much higher boost in their interferon level. So the first recommendation that I would have for you, now that you and I are living in the midst of a pandemic, is go to bed early. Your mother may have told you that many years ago, and now I'm telling it to you. Go to bed by 9 o'clock at least. Why? To strengthen your innate immune system, and so you won't get this infection as severely. Unfortunately, as I mentioned, if the vaccine isn't released soon, most of us will get a COVID infection. But if it's as simple as a cold for us, or not very serious illness, that would be certainly a lot better. So go to bed early. And you say, well, I have trouble sleeping. Well, if you have trouble sleeping, turn off your screen, whether that's TV or computer. Turn it off by 6 o'clock or so, except tonight, and that will make you sleepy. You know, one of the main reasons that we don't sleep is we don't make enough melatonin. And if you look at a screen, there's blue light there, and that turns melatonin right off. So if you have trouble going to sleep by 9 o'clock, turn down the lights, put on some soft music, and turn off your TV and your computer and your cell phone and your iPad and everything else. and you'll sleep better. And you can do that as soon as I'm done. All right, so that's number one. Go to bed by 9 p.m. or even earlier if you can. Number two, take a walk in the woods and expose yourself to some pine or fir or cedar trees. Well, where did this idea come from? Actually, the University of Osaka in Japan partnered with the University of Stanford and did some fascinating studies on essential oils found in trees. And what they did is they took these subjects and they had them go out into the country and take a walk, about a 1.5 mile walk in the woods. And they measured the levels of the essential oils that they had absorbed from their walk in the woods. And then they also measured the strength of the innate immune system, particularly the natural killer cells. And natural killer cells are one of the cells that really respond with interferon. And they found that the interferon levels were higher in those who had taken a walk in the woods, and they found that the natural killer cell activity was much higher as well. Natural killer cells are part of the innate immune system, and they are very effective in the fight against viral infections. So with COVID infection, you want your natural killer cells and monocytes and macrophages, all of which are a part of the innate immune system, operating at top performance. And they found that if they took these gentlemen out, actually it was men and women, took them out into the country and had them walk, that their natural killer cell activity really boosted. The other thing they found is in the walk in the woods, they measured their adrenaline levels, and their adrenaline levels dropped. Now, why is that important? Because adrenaline downregulates the innate immune system, and you don't want that to happen. So take that walk in the woods. Well, how often do you have to do it? They found, interestingly, that 1 walk a week was enough to keep the immune system boosted. The natural killer cell activity remained elevated for an entire week and then tapered off right toward the end. So while I'd be happy for you to take a walk every day, and particularly in the woods, even once a week, if that's all you can get in, will definitely help natural killer cell activity. Well, they wondered, is it just a walk in the country, or would you get just as much benefit if you walked in the city? So they took the same subjects, had them walk in the city. There was no benefit, no increase in natural killer cell activity. And then they thought, well, I wonder if it's something else. Maybe it's just the essential oil in the trees. So they took essential oil from a cypress tree, one that's common in Japan, and they put it in a diffuser in a hotel room, and they had the subject sleep in the hotel room, and then they measured their NK activity. And they found that the NK activity went up even if you didn't go out to the country, if you just had that fragrance diffused into the room while you slept. And that was great, except they didn't get the downregulation of adrenaline, but they still got some benefit from the essential oils from the evergreens. And we know that those same essential oils are found in pine and in balsam and in cedar trees here. The eastern white cedar has those, so does fir, and so does pine. So here in the Northeast, particularly here in Maine, the pine tree state, we're all set. And if you can't take a walk, that's all right. Go get some branches off your neighbor's tree and take them home and just put them in a little pillowcase by your head, and you'll smell that fragrance at night. And that's been shown to increase the innate immune system function. That's simple, that can be done, and I recommend it for everyone. I've been giving out some balsam fir branches to some of my employees that I work with, And you know, Christmas is coming. Buy your wreath early, and instead of putting it on your door, put it on your bed when you sleep at night, and you'll have that lovely fragrance, and there you'll be so thankful to be lowering your risk of severe COVID. You know, it's interesting, that's not a new idea. There was a Mainer who lived right close to here, actually on Elm Street in Topsom, and she was there in the late 1800s, and she wrote quite a bit on health. Her name was Ellen G. White. She was instrumental in the starting of the Seventh-day Adventist health movement, and she wrote this in the late 1800s. She said, "There is health in the fragrance of the pine, the cedar, and the fir. And there are several other kinds of trees that have medicinal properties that are health promoting as well." So this isn't new information, but it's important information. There's also been studies with the eucalyptus tree and eucalyptus oil. And if you're unable to go and find some pine or fir boughs, you can perhaps buy a little eucalyptus oil. Be careful with eucalyptus oil. In large amounts, it's toxic. It only takes a drop, and if you put a drop on a cotton swab and put that by the head of your bed while you slept, that would have a similar effect. That has also been shown to improve innate immune system function. So take your walk, that's the best, but if you can't take a walk, buy your Christmas wreath early, or borrow your neighbor's boughs from their evergreen tree. All right, there's another one that you can do. This one, fortunately, is widely available, although it is in a pill form, this time of year anyway, and that is you can take vitamin D. Vitamin D has been shown to increase immune system function, and in data looking at people who actually came down with COVID, those that had higher vitamin D levels when they contracted the disease, by and large had a much milder course. So I would recommend that you take vitamin D 1,000 international units a day. Now, is that how much you need for other reasons, or do you need more? That's a whole different topic, and that would require a blood level, and I don't think that's necessary for our purposes tonight. If we're fighting COVID, I think 1,000 international units a day is plenty. Would it be better to get it from the sun? Yes, but it is difficult to absorb vitamin D from the sun when your shadow is taller than you are. Now, you can go outside. It was a lovely day today. I think it was 70 here in Brunswick. And you can go outside at noontime, and if you look down on the pavement or on the ground there, if your shadow's longer than you are, you're not going to absorb much vitamin D. Come summer months, of course, when you go out at noontime, you hardly have a shadow at all because the sun is almost directly overhead, and you can make lots of vitamin D. There are photoisomers of D that aren't found in a pill that are good for you and are bioactive. So whenever you can, I recommend you get sun. Although this time of year we won't get vitamin D from it, it's not a direct enough ray. So get your vitamin D from the sun if you can, and that's when your shadow is shorter than your height. But if it's longer than your height, enjoy the sunshine, but you won't get vitamin D from it. And the fourth one is one that I mentioned earlier when I talked about treating the syphilis and diphtheria, and that is heat treatments. When you get sick with a viral infection, you often get a fever. And you think, oh dear, I've got a fever, I've got to take care of that right away, and so you run to the medicine cabinet, and oh dear, I've got a fever, and you take some ibuprofen, or you take some naproxen, or you take some acetaminophen, or you take some aspirin, And I'm here to tell you, don't do it. That's right, don't do it. You might be interested to know that almost 15 years ago now, the Journal of Infectious Disease gave people a viral infection, squirted some virus particles up into their nose, gave them an experimental infection, and then part of the group they put on acetaminophen, part on ibuprofen, part on naproxen, and part on nothing. And those that were on nothing felt a little bit worse for the first day, but they got over the infection much more rapidly. Those that were given the other things, they didn't get over the infection nearly as rapidly. Why? Because all of those medications take the fever away, number one. And some of them also depress the immune system. Well, why does your body give you a fever? Is it confused? Is it doing the wrong thing? No. Actually, if you have a fever, if you get your core body temperature up to 102 degrees, your interferon level will go up by 10-fold. Well, that's what you want when you're fighting COVID. You want to have a bounce in that interferon level. You want it to really get exuberant and stop that virus cold. Well, what if you don't have a fever? Can you induce one? Absolutely, and that's exactly what was done by Jackson and by the other gentleman in 1927 who won the Nobel Prize. They induced fever, and they found that if you get the core body temperature up to about 39 degrees centigrade or 102 Fahrenheit, the immune system really ramps up. The innate immune system is turned on in an amazing way. Well, you know, my wife has known this for quite a time, and whenever she feels like she's coming down with a virus of any kind, she disappears and she goes into the bathroom, shuts the door, and draws a big hot bath, and it takes, you know, about, well, I don't know, half hour or 45 minutes. She's just in there enjoying the heat. And I might as well not be there because she takes that hot bath, and don't disturb her. But you know, if she can get that hot bath in at the beginning of the virus, usually it's a one-day virus and she's done with it. And if you really want to do yourself some good, you take that really hot bath, get your core temperature up. Now, when I say really hot, it's ideal to have a thermometer, and you put it in the tub, and you want the temperature of the water to be about 104, 105 degrees, and then you get in and you take that, it feels like a hot tub, you know, and you get that core body temperature up. You can measure it if you want, or just stay in for 15 to 20 minutes until you're starting to sweat a little bit. You can put a cool cloth on your head, and that's good. And then when you're done with that, what happens usually when you have a fever? If you have a really good one, then you get a cold chill. Is that bad for you? No. In fact, that's your body's way of ramping up the immune system. And so you take that really hot shower, and then bath, and then you stand up and turn on the shower onto cold, and you think, oh boy, I can't do that. Actually, it feels quite good, and you will really turn on the immune system and interferon production. And the studies on that were done at the University of Toronto, and that's where they found that you could ramp up your interferon level by about 10-fold. So should you do that every day? Well, you probably don't have to, although I'm sure that some of you would like to. I know my wife likes a hot bath every day, and you know, if it keeps her healthy, I think it's more than worth the cost of the water. Can you do it another way? Yes, you can. If you're fortunate enough to have a sauna, you can do it with dry heat as well. Several of the physicians that worked on this in the early 1900s and late 1800s found that that was equally as effective. One of the primary places where they did a lot of work with this was the Battle Creek Sanitarium under the direction of John Harvey Kellogg, and they had great results there. And this was all pre-antibiotics. Well, in a sense, we're pre-treatment for COVID, and we know the steps from history that we can take to fight this illness. So there you have it, 4 simple things that you can do. Go to bed by 9 o'clock or earlier, get a good sleep, take a walk in the woods, and if you can't do that, at least get some of those pine boughs or fir or cedar and put them close to your pillow, and that'll help, or eucalyptus, but use that carefully. Take some vitamin D, 1,000 international units a day will help, and then a hot bath. Are there any questions?
Yes, there are a couple of questions. Before we get to those, one quick note about if you do take the hot bath and then follow that with a cold shower, be really careful that we don't get lightheaded.
Yeah, if you have a blood pressure problem, number 1, stay hydrated while you're in the tub. Keep some water by you and drink that water. Number 2, you may, if you're older, what do I mean by older? My age, 50 and up, although I'm over 50, you may want to sit on a shower stool when you turn on the water, because that will drop your blood pressure. Interestingly, if you do that regularly, you may not need that blood pressure medicine. If you are on blood pressure medicine, be very careful. As Cheryl's mentioned, do not stand up quickly because you will feel lightheaded.
Okay, a question. If you are an essential worker, when you get home from work, is there an advantage to gargling, using a neti pot, and eye drops to cleanse?
I think if you're any worker, there's probably an advantage to taking care of yourself. The most important thing if you are working, well, we're all working where we can get COVID. And so if you want to do your best, what I would say is wear a mask, wear some protective lenses, and these help some, but what you really want is either a face shield or goggles. You can pick up goggles like I did. I work in wood shop quite a bit, and I have goggles that I wear when I'm operating my table saw. And you can get some with foam around the edges that seal to your face, and they work very nicely. And actually, as I see patients today, that's what I do. I wear goggles. And then before you go home, I recommend that you wash your hands very thoroughly, and that you, well, I'll tell you what my son does. My son is working with COVID every day. He's in a pulmonary critical care fellowship in Ann Arbor, and he said, "Dad, take this disease seriously." When he comes home, he strips in the garage, throws his clothes into the washing machine, takes a thorough shower before he says hello to his wife or son. And that's the best. I don't think the neti pot's going to help as much as that. Keeping your hands away from your face is more important, and then washing them. And gargling is not a bad idea, but if you've worn your mask all day, you probably don't need to do that.
We do the same thing. My husband Dan works in the emergency room, ICU, and that sort of thing with COVID patients, and he takes a shower and he changes his clothes before he ever walks into the house. The shoes that he wears into the hospital do not come inside my home. And he washes his hands.
It's a little rugged in January, you know, to strip naked outside, so, you know.
That's okay. The next question, if you're already taking vitamin D3, should you also take vitamin D2? Is there a difference?
There is a difference, and if you're taking D3, you do not need D2. D2 has to be changed by the body into the active form. Vitamin D that I mentioned, the ideal is to take D3, the active form, and that's the most effective.